Pregnancy is a beautiful journey, but it can also come with stress, fatigue, and nutrient deficiencies. That's why today, we're sharing the top 10 natural supplements that are both safe and effective during pregnancy. Whether you're a new mom-to-be or planning ahead, these remedies can support a smoother, healthier experience. This video is proudly brought to you by Recs-Medix Natural Solutions, your trusted source for safe, natural health support. At Recs-Medix Natural Solution, we believe in supporting every expecting mother with nature's best. 10 natural pregnancy supplements, backed by nature. Here are 10 essential natural supplements often recommended during pregnancy to nourish both mother and baby. 1. Folic acid is the synthetic version of the vitamin floated, also known as vitamin B9. Floated acid is used to treat or prevent folate deficiency anemia. In pregnancy, folic acid helps to prevent neutral tube defects like spina bifida, a must-have even before conception. It is very safe and recommended by all doctors. Folic acid is naturally found in many food and is also added to some processed foods. Good sources include dark green leafy vegetables like spinach and kale, legumes like lentils, beans, peanut chickpeas, and certain fruits such as oranges, bananas, melons, and most berries. Others like eggs and sunflower seeds. Folic acid is important because it also plays a role in the formation of red blood cells and certain amino acids. Some of the healthy food that are high in folate. 1. Legumes. 2. Asparagus. 3. Egg. 4. Leafy green. 5. Beets. 6. Citrus fruits. 7. Broccoli. Folic acid most times is recommended to take 1 capsule daily during pregnancy. 2. Iron. Iron tablets are commonly recommended during pregnancy to prevent and treat iron deficiency anemia, which is more prevalent during this time due to increased blood volume and fetal needs. The World Health Organization recommend daily iron supplement starting as early as possible after conception with 30 to 60 milligrams of iron. It's crucial to take iron with vitamin C and on an empty stomach for optimal absorption while avoiding calcium-iron foods and drinks simultaneously. Why iron is important in pregnancy. Increased blood volume. Pregnancy requires a significant increase in blood volume, necessitating higher iron levels. Fetal development. Iron is crucial for the healthy development of the depths, particularly brain development and oxygen transport. Preventing anemia. Iron deficiency anemia is common in pregnancy and can lead to adverse outcomes like low birth weight and preterm birth. Supporting delivery. Iron stores helps women cope with blood loss during delivery. Recommendations for iron supplementation. Start early, begin supplementation as soon as pregnancy is confirmed, ideally even before conception. Daily intake. Daily iron supplementation is generally recommended throughout pregnancy. Dosage. The recommended dosage is 30 to 60 milligrams of elemental iron per day. Absorption. Take iron supplements on an empty stomach and with a vitamin C-rich source like orange juice to enhance absorption. Follow-up. Regular blood tests are recommended to monitor iron levels and adjust dosage as needed. Potential side effects. Constipation, a common side effect, which can be managed by increasing fiber intake and staying hydrated. Stomach upset. Some individuals may experience mild stomach discomfort, which can be minimized by taking iron with food, though absorption may be slightly reduced. Based heme iron sources. Red meat, beef, lamb, and pork are excellent sources of heme iron. Poultry, chicken and turkey also contain heme iron. Seafood, fish like tuna, salmon, and shellfish are good sources. Organ meats. Liver and other organ meats are particularly high in iron. Eggs, both the yolk and white contain iron. Vitamin D. Vitamin D is crucial during pregnancy for both the mother and the developing baby. It is recommended that pregnant women take a daily supplement of 10 micrograms, 400 IU, of vitamin D, particularly during autumn and winter, and possibly throughout the year. This helps ensure healthy bone development, and may reduce the risk of complications like preeclampsia, gestational diabetes, and preterm birth. Here's a more detailed look at vitamin D during pregnancy. Why is it important? Bone health. Vitamin D helps the body absorb calcium, which is essential for building strong bones and teeth in both the mother and the baby. Reduced risk of complications. Adequate vitamin D levels during pregnancy may lower the risk of preeclampsia, gestational diabetes, preterm birth, and low birth weight. Fetal development. Vitamin D is vital for the proper development of the baby's heart, kidneys, and nervous system. Immune function. Vitamin D plays a role in immune system development and function, potentially impacting the baby's long-term health. How much do you need? The recommended daily intake for pregnant women is 10 micrograms, 400 IU, of vitamin D. Some women, such as those who rarely go outside, have dark skin, or are obese, may need more vitamin D and should consult with their healthcare provider. Some research suggests that higher doses might be beneficial for certain individuals. Sources of vitamin D. Sunlight. The body produces vitamin D when exposed to sunlight, but this can be limited by factors like season, skin pigmentation, and sunscreen use. Food. Some foods like oily fish, salmon, sardines, eggs, and fortified food yogurts contain vitamin D. Supplements. Prenatal vitamins often contain vitamin D, but some individuals may need additional supplementation, especially those at higher risk of deficiency. For calcium. Calcium is essential during pregnancy for both the mother's health and the baby's development. It plays a crucial role in building strong bones and teeth, and supports the development of the baby's heart, nerves, and muscles. Adequate calcium intake, ideally through diet, can prevent the mother's bones from depleting calcium and can also reduce the risk of preeclampsia and other pregnancy complications. Why is calcium important during pregnancy? Fetal development. Calcium is vital for the development of the baby's bones, teeth, and overall skeletal system. It also supports the development of the heart, nerves, and muscles. Maternal health. Calcium is essential for maintaining the mother's bone health. If the mother's calcium intake is insufficient, her body will draw calcium from her bones, potentially leading to bone loss and an increased risk of osteoporosis later in life. Reduced pregnancy complications. Adequate calcium intake can reduce the risk of preeclampsia and eclampsia, which are hypertensive disorders that can lead to serious complications during pregnancy, including maternal deaths and preterm births. How much calcium do pregnant women need? The recommended daily intake of calcium for pregnant women is 1,000 mg mg. Most prenatal vitamins may not provide enough calcium, so it's important to get calcium from food sources. Food sources of calcium. Dairy products, milk, cheese, and yogurt are excellent sources of calcium. Fortified foods, many plant-based milk alternatives, like soy milk, juices, and cereals are fortified with calcium. Green leafy vegetables, dark leafy greens like kale, spinach, and collard greens are good sources of calcium. Other sources, tofu, 5-iodine. Iodine is crucial during pregnancy for the development of the baby's brain and nervous system. Pregnant women need more iodine than non-pregnant women, and insufficient intake can lead to various health issues for both mother and child. Why is iodine important during pregnancy? Fetal brain development. Iodine is essential for the production of thyroid hormones, which are vital for the development of the fetal brain and nervous system. Increased demand. Pregnancy increases the demand for iodine due to increased thyroid hormone production, higher iodine clearance by the kidneys, and the needs of the developing fetus. Prevention of deficiency. Adequate iodine intake during pregnancy helps prevent goiter, intellectual impairment, and other developmental problems. Recommended iodine intake. General recommendation. The Endocrine Society and WHO recommend at least 250 micrograms of iodine per day during pregnancy. Prenatal vitamins. Many prenatal vitamins contain 150 to 200 micrograms of iodine, often in the form of potassium iodide or iodate. Supplementation. Iodine supplementation is recommended for pregnant and breastfeeding women, especially in areas where iodized salt is not readily available or accessible. Keycap 6 omega-3 fatty acids. Omega-3 fatty acids, particularly DHA and EPA, are crucial during pregnancy for both maternal and fetal health, playing a vital role in fetal brain and eye development, and potentially reducing risks of preterm birth and postpartum depression. While dietary sources like fatty fish are beneficial, many women may not consume enough, making supplementation a consideration. Benefits of omega-3s during pregnancy. Fetal development. Omega-3s are essential building blocks for the baby's brain, nervous system, and retina. Reduced risk of preterm birth. Studies suggest that adequate omega-3 intake may help reduce the risk of premature birth and low birth weight. Improved maternal health. Omega-3s may help lower the risk of preeclampsia, postpartum depression, and potentially improve outcomes related to endometriosis. Dietary sources. Fatty fish, excellent sources include salmon, tuna, sardines, and herring. Algal oil, a vegetarian source of DHA and EPA, suitable for those who avoid fish. Flaxseed, chia seeds, walnuts, contain ALA, which the body can convert to EPA and DHA, but the conversion rate may not be sufficient. Supplementation. Recommended dosage. A daily intake of 250 to 500 mg of DHA is generally recommended. Supplement type. Consider fish oil or algal oil supplements, particularly if dietary intake is insufficient. Timing. Supplementation can be started from 12 weeks of pregnancy and may be stopped at birth. 7. Vitamin B6. Vitamin B6 plays a crucial role in pregnancy, particularly in the development of the baby's brain and nervous system. It also helps the mother's body metabolize protein and carbohydrates and form new red blood cells, antibodies, and neurotransmitters. Key roles of vitamin B6 in pregnancy. Fetal development. Vitamin B6 is essential for the healthy development of the baby's brain and nervous system. Maternal health. It supports various metabolic processes in the mother, including protein and carbohydrate metabolism and the formation of red blood cells and antibodies. Good sources of vitamin B6 include fish, meat, poultry, starchy vegetables, non-citrus fruits, beans, bananas, papayas, and whole-grain cereals. 8. Vitamin B12. Vitamin B12 is crucial during pregnancy for both the mother and developing fetus, playing a key role in nerve and blood cell development. Deficiency can lead to adverse outcomes like neural tube defects, miscarriage, and low birth weight. Sources of vitamin B12. Animal products. Meat, poultry, fish, eggs, milk, and other dairy products are excellent sources. 9. Choline. Helps brain and spinal development. Important in first trimester. Found in eggs, meat, or prenatal vitamins. 10. Ginger. Ginger can be a safe and effective remedy for morning sickness during pregnancy when consumed in moderate amounts. It may also help with other pregnancy-related discomforts like gas, bloating, and pain. However, it's important to consult with a healthcare provider before taking ginger supplement. Every pregnancy is different, and while these natural supplements are generally safe, it's always best to speak with your healthcare provider before starting anything new. If you're looking for trusted, effective, and natural wellness products, check out Recs-Medix Natural Solutions. We're here to support your health, naturally. Like this video if you found it helpful, subscribe for more wellness content, and drop a comment if you've used any of these supplements.